So primary CNS lymphoma is a rather rare cancer type, and it's a type of it's a type of lymphoma which is confined to the brain or meninges or the eyes at the time of diagnosis. And methotrexate is the backbone chemotherapy, which is being used as induction chemotherapy for many years. However, this may come with a profound side effect profile, which includes leukoencephalopathy, which may set on after years and years and may translate into cognitive long-term effects which prohibit patients to undergo further treatments when progression occurs because they're just clinically not fit enough anymore. However, there are no clear biomarkers to identify patients at risk at time of diagnosis to develop such leukoencephalopathy. And we speculated that the MTHFR genotype might be such a biomarker because the MTHFR gene encodes for a protein which is being involved in the intracellular depletion of MTHFR metabolites. And there are two big genotypes which need to be considered, the MTHFR 677 genotype and the 1290IH genotype. And what we found is a patient who do have the MTHFR 1290IH genotype do have more severe leukoencephalopathy on imaging. And interestingly, patients with that genotype had the same progression-free survival as patients without that genotype. However, also overall survival was limited. So what we speculated is that the MTHFR 1290IH genotype may have resulted in higher rates of leukoencephalopathy, which eventually may have translated into less cognitive fit patients, which then eventually has potentially resulted in lower rates of retreatment when progression occurs, which eventually has caused the lower overall survival rate.